How much is your physical pain tied to your emotions? Well, our next guest says a lot. Dr. David Hanscom is a spine surgeon who talks most patients actually out of having surgery. He encourages them to look at dealing with their feelings like anger and anxiety as part of the process in reversing chronic pain. Dr. Hanscom, you say that some of these search and destroy missions of back surgeries are really out of control, that there are times when spinal surgery really isn't needed. Why do you think so many unnecessary spinal surgeries are done?
Well, it's the way we're trained. Surgery is held out as a definitive answer for back pain, and it's definitive if it's structural and you can see it. If I can see it, I can fix it.
And what if it's not?
And if it's not, surgery is really not an option. But right now there's over 300,000 surgeries a year being done for vague symptoms. The actual success rate of a spine fusion for back pain is about 25%.
Wow, that's incredible. It's very small.
Right, and then the reason why I quit, first of all, I was a surgeon who was on both sides of this fence. The reason why there's so many surgeries are performed, by the way, is we're trained this way. I came to my fellowship with a zeal to do surgery, and I did endless number of fusions for back pain, and it became very disappointed pretty quickly that they didn't work. But I spent 7 years doing fusion after fusion after fusion. And then I started seeing people's spines break down around the fusion. Then the reoperation rate is 18% within a year. The success rate is barely higher than the reoperation rate. And by the way, a placebo effect is about 30%. So
how do you break this cycle? How do you break this cycle when even the people who you go to for advice when you're suffering with chronic pain are telling you that surgery is the answer?
Well, that's why I wrote the book. My whole thing is accountability. For instance, if you're my patient and came to me with back pain and were told by another surgeon that you needed surgery, I would talk to you about the different options of pain. And what solves chronic pain is that you address every variable. In other words, you take a structured approach that deals with all the variables, then you take full control. Once you understand the variables, you will take control. Then if you need surgery or don't, you'll have enough information to make that decision. Again, if it's a structural problem, most of the time it needs to be fixed. If it's non-structural, it should never be fixed.
Tell me about how a person who is suffering from chronic pain, when it's not a structural issue, can begin to deal with that, because you emphasize the importance of new neural pathways, a different way of thinking about your pain so that you can begin to manage it. Tell me about your method.
Well, recent research is very exciting. They've shown in these new functional MRI scans all over the country, but particularly Stanford and San Diego, that the brain has a concept called neuroplasticity. You can grow new brain cells at any age. And what you're doing, pain pathways are permanent. In other words, it doesn't matter what the source of the pain is, it always lays an impulse to the brain that becomes memorized just like an athlete or an artist. The trouble is with chronic pain, the pain pathways come in so fast, or the pain impulses come in so quickly, the pathways become permanent probably in about 3 months.
So what can you do to create new pathways so that you're not thinking about your pain and it's manifesting itself in your body in the same way?
So there's 3 steps: awareness, detachment, reprogramming. And we start with these simple writing exercises where you write down the anxiety-producing thoughts, you throw them away, and that's an awareness detachment step.
I have to stop you right there, because as a surgeon, if someone told you this when you were first going into medical school, that you were going to write down your problem and throw it away, and that it would begin the process of alleviating pain, you would have thought they were crazy.
Absolutely.
And why did that change for you?
Well, I went through a severe personal experience with chronic pain for almost 50 years. And by the way, it doesn't matter how long you've had the chronic pain, there's 33 symptoms of what's called a mind-body syndrome. Things like migraine headaches, ringing in the ears, PTSD, anxiety, burning in the feet. So I went through 16 of these 33 symptoms. It was only by my own pretty extreme experience did I actually discover the process.
And you began to have some hope then as well.
Right, and what actually broke me out of it, I went through every possible treatment you can imagine: medications, therapy, counseling, the whole thing. And therapy works, by the way, but as a reprogramming tool. And I read a book that told me to start to write, and I started to write. And within 6 weeks, things finally started to change.
And I'm so glad you mentioned that, because I know that you have found a lot of success with your method and with writing that method. As a matter of fact, we want to let you know that the book is called Back in Control, a Spine Surgeon's Roadmap Outside of Chronic Pain. Certainly a unique perspective. Thanks for sharing with us this morning.
Thank you.
We appreciate it. And for more information about alleviating chronic pain, you can visit drdavidhanscom.com.